Okay, we're going to pause for a second and take a question from the audience. And I believe I was told that our good friend Jerry Kelly has a question. Where's Jerry? There he is. So Jerry, for those of you who don't know, is
Doug.
a survivor from Birmingham.
Yeah, from Birmingham, Alabama. And I'm going to reserve the right to complain about being cold because we're in the South too. Doug, when we talk to people about the foundation, one of the things that we find ourselves doing is reminding people how young it is. How do you deal with that when we're trying to get growth and trying to partner with NGOs and countries and companies?
So, great question about how the foundation deals with being so young in terms of an organization. I'll say a few things about that. One of the things I mentioned earlier, and that we talk about internally, is being both naive and audacious. And the reason I say that is because for us, I think that's the best way to work. To be naive enough to think that anything's possible, and then to be given the leeway from our board and from our community to try things. And if they don't work, they don't work. And we are the first to admit, you know, that didn't work. Let's try something else. And so I think that's something that comes from being a younger organization. That said, I think we're also now at a point where we're dealing with issues of growth and what's the future hold. And you know, the easiest way to grow as an organization, if you want to become a massive organization, is to do the traditional sort of nonprofit growth strategy, which is you open up chapters and affiliates, and you invest in infrastructure, and you end up raising a lot more money, and you have a presence all over. And that's not what we want to do. I mean, it just, for us, that doesn't make sense. It wouldn't foster the creativity and the idea or philosophy of being naive and audacious. And so that's why we've decided that we're about partnerships. We're about working with others, whether it's grassroots advocates, whether it's partners in the Young Adult Alliance, whether it's the survivorship centers. You know, our goal is not to be the biggest and not to do the most. Our goal is to have the biggest impact. And I think that we're constantly looking at how do we scale these things, and the Y is a great example. How do you create a program and then partner with somebody that has locations everywhere, so that we don't have to do that? So I think if we can continue to think about creative and innovative ways to reach more people without necessarily becoming a massive, more bureaucratic organization, then that would be the goal.
Probably the only other thing I would add is for a relatively young organization, we have an extremely powerful brand. And so our ability to lead with that brand allows us to really increase our impact in a lot of different ways. So I think that's one of our kind of core strengths that's let us kind of grow even more rapidly within a relatively short period of time.
Absolutely. Christina.
I swear I turned it on. There it is. My name is Christina Luzad, and I am a LiveStrong leader. As somebody who advocates in the community, I have lost 3 grandparents and currently have a grandmother battling cancer. Much like everyone here, we have a connection. So I have a 2-part question for you. First, what is the goal for LiveStrong Day 2011? And then second, how can leaders like myself and others support you in reaching that goal so that you can save lives like my grandmother?
Great. Well, thanks, first of all, for all of your efforts and everything you've done over the years. We really appreciate it. LiveStrong Day remains for us kind of the still intent of LiveStrong Day is a global day of awareness and action, and really showing the power of that collective action in a number of different ways. So as a LiveStrong leader, you and others have obviously hosted terrific LiveStrong Day events, which is a key cornerstone of LiveStrong Day. But we also want to just make sure that we start translating it to a day that everybody can get involved with, whether or not they want to host an event. You can wear yellow, you can do everything in the spectrum kind of leading up to an event. Or if you're hosting an event, how can you recruit others to, again, just make it a real collective day of action and awareness building in your community. So I think what we're eager to explore in 2011 and beyond is just how we can take that to the next level and give you tools and resources, regardless of your level of involvement, to either host your event or invite others and share the story of Livestrong. So it's a great opportunity actually for everybody in this room, and we worked really hard in 2010 with all of our licensing partners as well to try to activate specifically around Livestrong Day. So we'll be focusing more on that, but every partner in this room can play a role in Livestrong Day. So we ask for that moving forward. But thank you.
And I would just add to Missy's point that, you know, Livestrong Day is an opportunity for us to try and leverage this brand for the greater good. And so when we encourage people to get involved in activities on Livestrong Day, it doesn't have to be an activity that supports our organization. It could be something local in your community. It could be, you know, leveraging that visibility and that mobilization for something that's needed for your organization or your area or your community. And so, again, I can't emphasize this enough, that this is not about Livestrong becoming a bigger organization or having, you know, the most resources. That's not the game that we're playing. We are ultimately just passionate about making sure that people who need support and resources get them when they need them. Yep. And you mentioned wearing yellow, so I'll give Missy and Scott credit because they're obviously the only two up here that are really wearing yellow, nice. Aside from a wristband. But okay, I think our next question is Alton.
Hello, my name is Alton Hart. I'm a member of the Centers of Excellence Network Steering Committee. I'm also the medical director for the Adult Cancer Survivorship Clinic at Massey Cancer Center. So in both roles, it's really important for me to have patients have access to various services. And Doug, during your address, you talked about patient navigation. Can you say more about the types of navigation services provided by Livestrong?
Sure, and I'll let Andy talk more specifically, but I mean, you know all too well because you see patients all the time who are probably extremely frustrated that they can't figure out what information they need and when they need it. And you know, one of our biggest frustrations historically has been when people say, I wish I would have known about that 6 months ago. And it happens all the time. Why didn't I have access to that? Why didn't my parents know about that? Why, you know, it still happens today. And so the challenge is not necessarily always you got to create new programs. The challenge is getting people to the right program at the right time. And Dr. Freeman in Harlem has really pioneered this concept of let's just deliver what we already know to the people who need it the most at the right time. And what do you know? We improve people's lives and save lives. And so I'll let Andy talk more specifically about what we're trying to do from a navigation standpoint. But we as a cancer community should never allow people to fall through the cracks. It's not acceptable, and it's not something that any of us should stand for.
Right. Yeah. You know, it's one of those things where, you know, the more you learn, the more you understand how much needs to be done. And we have such great resources that are available to us in this country. The problem is very rarely do we connect those resources in a way that makes sense for people. And for those of us who have been diagnosed, oftentimes that's our first experience with being thrust into this system of trying to navigate those resources. So, you know, you learn as you go. If we can take some of our resources and help people to navigate that system and create pathways for them based on what we know works, you know, getting people to the right resources, or give them the right information in the right amount at the right time that actually is going to improve their outcomes, as well as create efficiencies for our system, that's where we see the opportunity. So we have invested in navigation programs over the last several years, primarily through the phone and web-based interfaces. But as Doug said, and as you saw in the video, we've opened up our first Livestrong Cancer Navigation Center, and are going to be doing this face-to-face for the Austin community. The goal is, if this is successful and we're actually able to do something that brings together the Austin community of resources, and I'm talking about clinical resources, social services, practical assistance programs that are available, and are able to not only improve access and navigation for for patients and their caregivers and loved ones, but actually have a better, more efficient system where it doesn't matter where you're diagnosed or what facility you're seen at, you have access to those same navigation resources. And our community is a much stronger one. We believe we have potentially a game-changing model that we could take to other cities. And with their partnership and investment, we could create that same type of service for them. We've just begun to scratch the surface with understanding the value of patient navigation, but we do know that there are significant challenges for people to access resources, specifically psychosocial and practical resources, because those are the things that the medical community doesn't always tell you about. You know, oftentimes we hear from survivors that the physical aspects of my disease are almost the easiest thing to deal with, because I know who to go to for that. And there's lots of information and lots of direction as to what needs to be done. It's the other emotional and practical resources that oftentimes are left on their own to try to figure out. And so there's so much more to be done, but through partnerships with great groups like Patient Advocate Foundation, Emerging Med, and we're bringing on 2 new partners through our navigation services this year, Immerman's Angels, that help provide one-on-one peer support for newly diagnosed patients, and Navigate Cancer Foundation, that with the assistance of their oncology nurse navigators can help patients understand the more clinical aspects of their disease, ask questions that maybe they didn't get answered, you know, by their healthcare team. We feel like we're rounding out a service package that are really addressing some gap needs for people. But again, it's an iterative process. We're continuing to learn what survivors need, how we can forge new partnerships to help address those, and you know, engage all of you in that process.
And aren't there a lot of different models of navigation? Because there's facility or treatment center based, and there's community, and then there's other, I mean.
So we're, in navigation, we're kind of in the same place we were with survivorship, you know, a few years ago. You can almost define it however you want. And unfortunately, right now, a lot of navigation means navigating a physical entity like a cancer center, getting from point A to point B within that cancer center and making sure you have a streamlined experience. And there's lots of research going into that. What we're really talking about is a systems-based approach to navigation. How do you take everything that's available to someone and, through better understanding their needs, create a pathway for them that allows them to access those resources that are most appropriate for them? Because we have heard, again, there are lots of great resources out there, and survivors tell us all the time, don't give me more, give me help me understand which are the right things for me based on my needs.